And when we think of rehab, we often think of physical rehabilitation, such as moving our limbs to increase mobility and stability. But what about neurological rehab? Who needs it, and what does it entail? Here to tell us about it is occupational therapist Allie Mezger from the Hartford HealthCare Rehabilitation Network. Allie, thank you for joining us.
Thank you.
Tell us about the neurological rehabilitation services that you offer.
So when most outpatient clinics, you think of physical and occupational therapy for something more orthopedic like a shoulder injury or back pain. But what's unique about our clinic in Cheshire is that we offer physical therapy, occupational therapy, and speech therapy services catering to people with neurological conditions.
And tell me a little bit more about the type of conditions that these services are used to treat.
Absolutely. We treat people with progressive neurological conditions such as Parkinson's, multiple sclerosis, ataxia, and people who've had a sudden neurological injury or event like a stroke, a traumatic brain injury, or spinal cord injury. These are conditions that are frequently under-recognized or underserved, and we know it can be really difficult for people to find the right type of clinic to get the right kind of therapy that's designed for their needs. Beyond something that an orthopedic clinic could offer. We know, especially a lot of our patients have had bad experiences in the past trying to find the right clinic, so we want people to know that you can find therapy that is designed to treat your needs. And we have clinicians here who are experienced and specialized in treating those conditions. We have the equipment and training to treat people to help improve their balance, hand function, dexterity, memory, their ability to swallow without choking, the clarity and volume of their voice. Even simple things like dressing yourself can be an insurmountable task. Managing stairs safely, preventing falls and getting up from falls safely. And these are needs that neurological conditions have that really need specialized training to treat.
And what can you tell us about the type of technology that you use to treat these patients?
We have a lot of really great technology here. We're very lucky to have some of the equipment we have. We use neurological muscular electrical stimulation through the Bioness system to help activate cause a muscle contraction in muscles that patients are having difficulty activating themselves. We have a light gate that can help offload a person's body weight to allow them to walk without fear of falling, to practice mobility. We have standing frames to help people who cannot even stand on their own, just to build bone density and their tolerance for standing. We have software, the Synchrony software, that just helps train people on exercises to improve their swallow function. The IOP, which helps strengthen tongue muscles for swallowing. So we have a lot of really great advanced technology to help and the expertise to treat those conditions.
And real quick, Allie, because we're running out of time, what are some of the outcomes for patients?
Outcomes can look different. Sometimes it's training caregivers and family how to help that person safely. Of course, we're always working on recovery of lost function too. And then just learning how to live with the condition that you have and what can be recovered and what can be compensated for.
Allie Mezger with Hartford HealthCare Rehabilitation Network, thank you for joining us.
Thank you.